So, good afternoon to all. Let's start the lecture on alternative and complementary therapies. So, there are three types of therapies. Uh, One is conventional medicine, which is also known as allopathic medicine, and it is science-based medicine and type of medicine which is usually taught in the medical schools. And the term alternative medicine is these are the recognized practices and refers to an intervention that is used instead of conventional treatment. Complementary therapy is add-on therapy which is used in conjunction with traditional or conventional medical treatment. So in the Indian scene, we have Department of Indian System of Medicine and Homeopathy formed in 1995, which is replaced by Ayush Department. The Ayush is the form for Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy, which is under the Ministry of Ayush, formed in 9th of November 2014 to spread the knowledge about alternative therapies. So there is an increasing trend. Complementary medicine is used as holistic health care, which deals not only with the physical problems, also with the emotional problems, psychological problems, and it has a spiritual component also. So nowadays, in large number of even in US medical schools like Harvard, Yale, now offer course in holistic method of alternative therapy, and American Medical Association also encourage its member to become better informed regarding these practices. There are various type of complementary and alternative therapies. The one is the whole medical system in itself. It's a whole course uh, or a course or a number of years of experiences or teaching is required to pursue this medical system. The examples are anthroposophically extended medicine, uh, similarly Ayurveda, Unani, Siddha, and all these are course-based alternative medicines. Psychotherapy is also part of it. Physiotherapy is also part of it. Some are biologically based practices which are not as a whole course, like cell treatment, chelation therapy, management of diet, dietary supplements, herbal products, metabolic therapy, nutritional supplements, oxidizing agents are the other biologically based practices. Some are manipulative and body-based practices like acupressure, acupuncture, Alexander technique. We will go through about all these in a single slide because the scope of this lecture is very limited to explain in the detail. We will go through it one by one. So first start with the herbal medicine. So we know that plants and herbs are being used for many years, many centuries, and maybe dated back to 3000 BC. The two system which uses herbal medicine, like Pensao in China and Ayurveda in the Indian subcontinent, and the Ayurveda is based on and includes the therapies like herbal medicines, special diets, meditation, yoga, massage, laxative enemas, and medical oils. WHO, WHO also have guidelines regarding their control, their regularization, registration, and how to use the herbs. So WHO is also involved in it. In the Indian scene, we have Drug and Cosmetic Act of 1940 and Drug and Cosmetic Rules of 1945 to regulate the import, manufacture, distribution, and sale of drugs and cosmetics. So this is a notion regarding the herbs and plant treatment that it is natural means it is therefore completely safe. Uh, it's a myth and it's a notion that all the herbs and plants as a medicine are not. completely safe. They may have side effects. They may be highly toxic in their natural state. And because of lack of regulation and standardization in some therapies for some herbs, it's, these may be adulterated with toxic substance, and some manufacturer have some kind of manufacturing process that they may alter the potency of these herbs. Like drying the herb may lose its potency. In addition, it is often safer to use preparation like herbs in when only one herb is used. It is generally considered safer, and there is a greater likelihood of having side effects when there is a mixture of uh, two or more herbs. So these are the examples of side effects of some herbs like allergic reactions with chamomile, feverfew, bleeding may occur with dawn quai, garlic, ginkgo biloba, white willow, dizziness with cat claw, kava, dry mouth with peppermint oil, St. John's wort, valerian, elevated blood pressure with non-deglycerinated licorice. Headache with Asian ginseng, ginkgo biloba, valerian. Insomnia with Asian ginseng, feverfew, St. John's wort. Nausea and digestive upset with bacopa and others. And rashes and sun sensitivity may also occur. So you see that side effect is not with the allopathic medicine only. The Ayurvedic and herbs can also have the side effects. So this is a general notion that Ayurvedic herbs do not have side effects. Another is acupressure and acupuncture. So acupressure is a traditional Chinese medicine dating back to the 3000 BC, and the concept of this acupressure and acupuncture is based on uh, that healing energy flows through the body along specific pathways called as meridian. So these healing energy is known as chi. It is believed that these meridians of chi connects various parts of the body in a way similar to the way in which the line on the road map link various locations. So there are meridians. You have seen that meridians on the globe also, on the meridians on the map of the earth also. There are meridians. So similarly, they consider the meridians in the human body. So these points are the cross-sectional point of these meridians are called acupoints. Therefore, it is possible to treat a part of body distant to another because they are linked by a meridian. So this is the concept of this acupressure and acupuncture, and the proper flow of chi along energy channels within the body is crucial to the person's health and vitality. So in the next slide, you will see the procedure of this acupressure and acupuncture. In the picture on the right lower side, you can see the meridians are drawn on the uh, human body. So this is the basis of acupressure and acupuncture. So in acupressure, the finger, thumbs, and palms and elbows are used to apply the pressure, while in the acupuncture, there are thin needles as thin as hairs and sterile and disposable. They are inserted into the uh, acupoints, and this procedure is painless also. You won't feel the pain because of thinness of the needle. Another is Alexander technique, which was developed by F.M. Alexander, and Alexander F.M. Alexander used this technique on himself when he developed aphonia. So he used changing his body posture, and ultimately he regained his voice after this using this technique. So he developed a theory of proper use of body musculature to help alleviate somatic and mental illness. And Alexander's approach is an educational process that reduces habitual unnecessary muscular tension in everyday movements. So this can be somewhat related to the physiotherapy when they advise someone to take some kind of posture to maintain the posture to avoid the straining and stressing of the musculature. This technique also improves cardiovascular, respiratory, and GI functions, and as well as the mood. Further, anthroposophically extended medicine is a medicine which is developed by Austrian philosopher Rudolf Steiner. The healing process involves the use of conscious understanding, which Steiner called anthroposophy or the wisdom of the life. It focuses on the mental exercises that enables person to find a balance between mind and the body. Aromatherapy is therapy in which plant oils are used, and it was named by the French chemist Maurice Gettifos in the 1928. The essential oils of the plant are organic compounds that are benzene derivatives. Aromatic substances were used in ancient civilization as both medicine and perfumes. So today plant oils are inhaled using atomizer or are absorbed through the skin via massage. So oils can be used as a alternative therapy and known as aromatherapy. So its effects are analgesic, it has psychological effects, antimicrobial effect, and which is demonstrated scientifically also. Ayurveda, we all know the Ayurveda is best practiced in Indian subcontinent, and the method of examination is uh, examining through the pulse, the urine, the heat or coldness of the body, and the treatment relies on uh, multifactorial approach like diets, medicine, purification, enemas, and bloodletting. Bioenergetics, based on belief that dammed up energy produces maladaptive behavior patterns, evolved from the work of Austrian psychoanalyst Wilhelm Reich, who studied the Sigmund Freud. So, on the after influence with the Sigmund Freud's theory, he developed this bioenergetics, and he believed that energy fields were propelled by the sexual impulses called urges, and that and and the satisfactory orgasm indicated healthy bodily functioning. So it is based on the psychosexual theory of the Sigmund Freud, and he faced the bioenergetics and made one of his theories. Chelation. Chelation, we all know that is a traditional medical procedure used to treat accidental poisoning with heavy metals such as lead, arsenic, and mercury. This chelation is also used in emergency medicine also. No, it is not a entirely separate entity. It is used in emergency medicine to uh, combat the heavy metal poisoning. The chelating agent known as EDTA, in the shorter form it is known as EDTA, ethylene diamine tetraacetic acid, is infused into the bloodstream and it binds with the metal, and the metal is eliminated through the urine or GI tract. So the next one is chiropractic. Practice diagnose illness by clinical examination and X-ray. The treatment involves manual manipulation of bones, joints, and musculature to restore the biomechanical functioning. You must have seen that shots on the YouTube of chiropractors. They used to what you can call they used to crack the joints with a thrust of force. So this is the largest independent alternative health profession in the Western world, and they are recognized by the government in the Western world and also with the insurance agencies. And so this is about chiropractic. Colonic irrigation. Colonic irrigation is a technique known since antiquity for the many decades that consists of flushing the intestinal colon with the large quantity of water and sometimes with the minerals or other substance like uh, coffee is added. This is a method which is supposed to eliminate the intoxicating material in the bloodstream, and anecdotal reports also reports of improved general health as a result of such practice are common. However, the risk of electrolyte imbalance is there and may be a cause of intestinal perforation. So this should be cautiously used and should be uh, the knowledge should be gathered thoroughly. Color therapy. So color therapy uh, is a therapy of colors, and it believes that some kind of color have different kind of impact on the mood of the person. For example, blue is believed to be sedating. When person is in the influence of blue color, it may be sedating. Sometimes you may have heard that the blue light is used in the bedroom to induce the sleep. And red color is excitatory, which excites the mood. Pure red is considered to be sympathomimetic, and blue is considered as parasympathomimetic uh, action. Dance therapy, it is a another therapy in which the movements, synchronous movement, and all movements are considered to have effect on the particular area of ill health, and dance is a specific creative act within that. So, American Dance Therapy Association defines dance therapy as the psychotherapeutic use of movements which furthers the emotional and physical integration of the individual. It has four basic goals. First is the development of body awareness. The person becomes more aware about his body, and expression of feeling, how to express their feeling, the fostering of interaction and communication, and integration of the physical, emotional, and social experiences. So you can correlate this with the Kathakali in the south when they use their facial expression, the body movements. They use lots of fine movements of their face to express their uh, inner emotions. So this is also kind of dance. The next is diet and nutrition. Diet and nutrition, we also already know that diet and nutrition is very important and helpful to maintain our health. And this is because some particular area like in Asia, diets are low in fat and there is low incidence of cardiac diseases. Not in the southmost Asia, but we used to use lot of oils and ghees in our diet. But if we go upwards, then the use of fat is very low. Like in China, Japan, they used to cook without oil or with a very less amount of oil. In Mediterranean country, these are high. There are high user of olive oil, garlic, and grains, and this is associated with the low incidence of colon cancer. But this has a opposite action also. Some kind of food may cause allergies and implicated in many conditions like arthritis, asthma, hyperactivity, ulcerative colitis, and others. Other than diet, there is a dietary supplement. Diet and dietary supplement are different. Diet means what is recommended is used on the daily basis, while dietary supplement is required in cases of deficiency in the state of deficient. So various vitamins, minerals, amino acids are used for dietary supplement, and many cases the supplement is actually an extract, metabolite, or combination of the main substance. Medicinal benefit are well documented with supplement, and as a general rule, supplements should not be taken by a pregnant female or lactating women. So in psychiatry, nutritional supplements are being used to treat a wide spectrum of illness, including cognitive, mood, psychotic, sleep, and conduct disorder. However, little scientific evidence currently supports their efficacy. So this is the sure short example of use of dietary supplement in the case of alcohol dependence. When a chronic alcohol dependent patient become depleted of uh, multivitamins, mainly the thiamine, vitamin B12, and folic acid. And deficiency of these vitamins may lead to uh, syndromes called as Wernicke's syndrome or further Korsakoff, Wernicke's encephalopathy and further Korsakoff's syndrome. So when treating the or managing the alcohol dependent patient, so supplementing these vitamins are mandatory. Environmental medicine. Environmental medicine is a kind of preventive medicine. This was started in 1950s when physicians such as Theron Rodolph, professor of allergy and immunology, began to examine some persons' allergic reactions to the various food. So the things or our environmental factors like food additives, electromagnetic fields from electric utility wires, uh, chemicals like fertilizers, hormones used in food production, the waves from microwaves, television sets, cellular telephones, and nuclear radiations are considered in this environmental medicine. So practitioner of environmental medicine believe that many persons are extraordinary maybe sensitive to the environmental contaminants that can trigger a disease process. So this can be also considered uh, contemporary with the occupational hazards. For example, someone is working with the uh, so some illnesses you may know that the like silicosis and other are occupational hazard and may be considered in the environmental medicine. Some issues are controversial in environmental medicine. For example, despite claims to the contrary, study fails to demonstrate higher incidence of cancer in person exposed to electromagnetic field. This is being said nowadays for the decades that electromagnetic field of these mobile towers are causing maybe causing brain cancer or uh, maybe may have impact on fertility of male persons while when they are using their mobiles in the pockets of the trousers. So there are controversy, but correlation does exist. For example, the cancer rates in living near oil refineries and chemical plants may have higher rates of cancer. So it's a kind of preventive medicine while considering these points when a person consider these points and lives with the advice that you have not to do this or you do not have to live this or you have to use mask and other things to prevent such kind of illness is comes under environmental medicine. Exercise, we all know exercise is always beneficial to the physical and mental health, and it shows effect in ameliorating depression, anxiety, PTSD, and improving cognitive function in the person and improving the self-esteem and reducing psychotic symptoms in the schizophrenia population. So it is known that the exercise cause release of serotonin, adrenaline, and endogenous opiates, which cause reduction of symptoms of these disorders. And also, this is known that exercise releases endorphins from the joints, which is also have analgesic effect and mood elevating effect. Feldenkrais method, Fel- Feldenkrais method was developed by Feldenkrais. He thought that the body should be He thought that the body should be emphasized as much as the mind, and the proprioception can influence the behavior. The proprioceptions are somatic sensation from the muscle and other organs. He believed that posture and the position of the body reflected conflict, therefore retaining the body part of his uh, treatment program. The practitioners of this method are active throughout the world and has been used in central nervous system disorder like multiple sclerosis, cerebral palsy, and stroke. An older person who use this method claim that they retain or regain their ability to move without strain or discomfort. Other than herbs, there are psychoactive herbs. So many phytomedicinal have psychoactive properties that are used or have been used to treat a variety of psychiatric conditions. Adverse effects are possible and toxic interaction with other drug can occur with all phytomedicinals. So for example, mescaline, psilocybin and ergots were used to gain spiritual and personal insight. LSD used as a tool for understanding psychosis and for facilitating psychotherapies. This method is not used now. It's a matter of past. Homeopathy, we all know the homeopathy is a branch which is developed in Germany and developed by German physician. And this is used in a unique and several ways. The homeopathy contains more than the 2000 medications, including those from the plants such as aconite, ergot, and hellebore, minerals such as silver, copper, gold, iodine, and animals such as snake and jellyfish venom and tissue extracts. Light and melatonin therapy. So this is light therapy is based on concept that humans are subject to circadian rhythms and dyes that affect physiological process in predictable ways. So light therapy is also used in psychiatry in seasonal affective disorder, in which particularly the episodes of depression occur in the winter times. So it is thought that in the winter times the duration of sunlight is get reduced because of this the person is having more episodes in the winter time or particularly in the winter time. So light therapy is used in the extremes of the day, in the morning and the evening, to extend the exposure to the light. So exposure to the light can be extended as if it is in the summers. Macrobiotics is a health practice that focuses on living in harmony with nature using mainly a balanced diet. So it is developed by German physician and philosopher Christoph, wrote an influential book on diet and health, macrobiotic, or the art of the prolonging life.